Jason Dean, Revolution Network, coming to you today to give you a little update. So, a news article, independent, as you can see here, out of, I believe, the UK. Now, the headline, 1-year-old prescribed antidepressants by the NHS in Scotland. A little below that sub-headline, as many as 450 children given mood-altering drugs by health services in Tayside, which I believe is probably a township or something over there. New figures reveal. So these articles kind of slide out there and they're not part of mainstream news, so I stumbled upon this. And as you go down, obviously the 1-year-old prescribed antidepressants, obviously this is a massive problem. So you've heard me before talk about we cannot be on these antidepressants, SSRIs, psychiatric psychotropic medications. They do far more harm than good. So we actually have down here, so this is in 2014 that this happened. This was actually just recently released though. And then as we go farther down, it says, the spokesperson down here says, antidepressants are a type of medication used to treat clinical depression or prevent it from recurring. So let me add something there. There is no clinical aspect to any of these medications because there's no objective diagnostic testing that you can actually do to show somebody has quote-unquote a mental health issue or depression or anxiety or anything like that. It's only a subjective, meaning the patient tells you, I feel this way, but there's no blood test, there's no MRI, there's no radiograph testing, there's no testing, there's no hair sampling, there's no anything that will actually prove out that a person has a mental health issue. And I put that in quotes because, again, it's very subjective. They have no proof. They go off of voting, meaning they get together a couple times a year, a couple times every couple of years, and they vote over symptoms, and that is their clinical outlook and diagnosis. That's what it's based on, which is complete. It goes against all science, all medical science, anything. So it's the only quote-unquote medical degree that they're allowed to do that. Everyone else, even myself included as a chiropractor, we have to have clinical diagnosis. We have to have objective findings. We do tests to find out what is actually going on with the person, whether it's nutritionally or from a spinal standpoint, a structural standpoint. So I'll scroll down here even farther. It says they treat a wide variety of medical conditions such as chronic pain and anxiety disorders. Chronic pain doesn't come from that. So anxiety doesn't create chronic pain. Anxiety and chronic pain can be completely separate. They can be together, but they don't have anything to do with each other. They don't correlate. Down here, appropriate for individual patients, antidepressants are prescribed and often used in combination with therapy to treat more severe depression. So they're kind of pushing you more into this. Now, I want to point something out down here. Now, it's actually interesting. So alternative treatments for depression include talking therapy such as cognitive behavior therapy and counseling. Regular exercise has been shown to be helpful with mild depression. So they're actually saying that exercise can help with mild depression. They don't say it can be with strong depression, but at least they put it out there, but they still believe you need to be drugged, which is completely wrong. And then below that, the figures show the most common age group for antidepressants to be prescribed was for those aged between 14 and 17, and that girls were more likely to be given the medication than boys. So there's a little bit more down there, but the basic is they're giving this medication. Their biggest age groups between 14 and 17 years old, and if you think about it, think back to when you were 14 to 17, or think about those kids you see out there now, those teenagers 14 to 17, a lot of confusion in life. They're going through hormonal changes. They're going through whether it may be bullying or dealing with kids, confidence issues, etc. So they're going through a lot of emotions, and they're basically this system, the medical system, psychiatric system, etc., is now making all of that normal stuff that a kid has to go through, and they're tying a label to it, making them say, well, that's not normal. You must have something wrong with you. This is so dangerous. I've given some of you my backstory. I posted many times that I was prescribed 2 Zoloft and Adderall in my mid-20s because I was having some of these same things. Now, mine was actually more job-related and just personal stuff, which has all been handled, gone, done. It took a lot of nutrition, took a lot of self-development, took a lot of things, none of which were drug-related, to actually handle that stuff. So when you see these kids out there, they do need someone to talk to. They do need someone to handle. They need to know about life, right? They need to eat better. The food system is a mess. They're putting tons of sugar, tons of carbs, tons of really just bad foods in their system. When they go to school, between breakfast, lunch, and when they get home, and all they've had is, pastas, grains, etc., and sugar, their brain can't run. So you're having all these emotional, hormonal things changing at this age, and on top of that, you put in the junky foods. Parenting today, we have a lot of broken houses, broken relationships and parents, and they're dealing with that. So kids at this age have a lot of stuff on them, but I will tell you, going back up here to this headline, they don't need antidepressants for it. Absolutely. And to prescribe a 1-year-old antidepressants, actually the 0 to 5 years old is the fastest growing market right now for the pharmaceutical companies, and they know that. They're actually prescribing 0 to 5 year olds Ritalin, Prozac, etc., and they're also giving it to women who are pregnant to slow down an overactive fetus. That's what they call an overactive hyper fetus. Those are dangerous words they use. Hyperactivity, distraction, the ADD, ADHD, it's all made up. It's not real. I will tell you from personal experience, but I wanted to show you this today because it's completely insane, and 1-year-olds should never be prescribed antidepressants. No one should be, but this is insane when we're going this young. So, guys, come check this out. Share this video out there so we get out to more people so we can save more human beings. That's really my sole purpose and mission of this channel, is to get out there and to actually allow people to understand they're not alone, they can get healthy, and these are not the answers. Have a great day. Dr. Jason Dean, Revolution Network, signing off. We'll see you next time.